My next guest is Andrew Rosenberg, CEO and founder of Responsum Health. Andrew, come join me in the Startup Health studio.
How's your day?
Doing great. How are you doing?
I'm great, thank you. What a great conference.
Is this your first Startup Health Festival?
It is. We joined this past year.
Awesome, awesome. Well, welcome. What's the experience been like?
Fantastic. A lot of energy.
Yeah.
A lot of good ideas. A lot of really productive meetings.
Good.
With hopefully with partners of the future. So.
Were you one of the, or were you a few of the 2,000 plus meetings that took place on the third floor?
I was a small piece of that, but it felt like a lot to me.
You could tell that there were a lot going on.
Yeah.
Cool. So Responsum Health, tell me what you guys are building.
So our moonshot is to make the internet work for patients with chronic diseases.
Make it work.
So rather than, you get diagnosed with a chronic condition like my mother did.
Okay.
Doctors will tell you, don't go to Dr. Google, don't go online. You'll find only information that's maybe outdated, difficult to understand, may not be appropriate for you, maybe misleading, fake news, all that sort of stuff. There's a lot of bad stuff. But you go to Dr. Google anyway, because everybody does. Yeah. And so we worked with Carnegie Mellon University for a year to sort of identify the pain point for patients like my mom and like me, who is her caregiver essentially, in trying to identify how we access, where we look to get information. Doctors only have so much time to spend with you, right? WebMD is a great resource, but it's a static resource. It's like an encyclopedia. Yeah. As a patient, what I want is I want to be searching. Actually, I want somebody smarter than me searching the web every day, and then breaking down for me, which is what we do, article summaries of blog posts, articles, videos, whatever's appearing on the web. We're breaking it down, we're categorizing it, so it's a searchable database. We're putting it in a really dynamic app and feeding it to you through a news feed. There are other functionalities on the app, but the primary sort of value proposition for patients is they've got a professional team and computer algorithms pulling content from the web and summarizing it in an easy to understand form. And a part of the secret sauce is we do this in partnership with leading patient groups in the space. So it's not just us, and it's not a company that you're getting information from. All of the content that we provide through our newsfeed has been vetted by the leading patient group in a given area.
Gotcha. I was just going to say, it's a massive amount of content, and I'm wondering how you handle bringing it all together. But it sounds like you're creating partnerships with organizations that can vet and help you organize.
Yes, but as a practical matter, there's really maybe only a half a dozen articles or so a week of new content that's not duplicative of other things that are out there that we think and that our patient group partners think is useful and helpful to patients. And then obviously through sort of detailed review of our analytics, we're able to sort of identify what sort of articles are driving user engagement and the like. So what we're able to do then, and what we did this past year in pulmonary fibrosis, which was our first project, we did that in partnership with the Pulmonary Fibrosis Foundation. And we have an incredibly sticky experience for patients where last month over 96% of the patients who had downloaded our app used it repeated times in the course of a month. And that's because it's like the same Facebook thing, like new content is what drives engagement. So now once we have that patient group and we're building a community in that given disease, and we've got some exciting ones in next year that we're planning on, we then are able to sort of extract some really important insights, glean some information, data, survey them, et cetera, and that can really help to further innovation.
Interesting. So you started in one disease, and you're going to sort of build out from there.
Yeah.
Where do you see that expanding over the next couple of years?
So the dream is to have a Responsum Health app for every chronic condition, right? And there are different value propositions for larger, big chronic conditions, like some of the big diseases that your other guests are tackling. But there's also an argument and a real need for ultra rare diseases to connect parents oftentimes around the world into an information hub that also has a social wall, that also has a capacity to engage with each other. So we're really excited that this next couple months, this quarter, we have an agreement with Otsuka, which is a big sponsor of Startup Health, to build, in partnership with leading patient groups, a platform in chronic kidney disease. So we've got a bunch of other things that we're working on as well, but that one I can announce today.
That's awesome. That's fantastic. I mean, the theme of this festival is collaboration, so to see a new company in Startup Health working with one of our LPs. Very exciting.
Yes.
Andrew, love hearing about what Responsive is doing. Appreciate that you're innovating in education, which is an area that needs more investment and needs more attention. So it's really a critical area of need. So thanks for your work, and hope you have an awesome rest of the festival.
Appreciate it.
And
It's
best
great
of
to
luck
meet
in
you today.
2020.
Thank you. Great to
All
meet you.
right,
Thank
thanks,
you.
Andrew.